So we have a special session here. I will let Dr. Kirsh explain. Dr. Kirsh will be moderating the session. I will let her explain the drill that we're going to go through, which I think will be very interesting. So, Susan?
Thank you very much, Ken. So thanks to everyone who's remained in the audience. I'm very excited to go through the panel here. When I thought about with the group the task at hand here and how to really share the experience and the perspective of the patient, the scheduler, and the clinician, both in primary care, clinician, physician, provider, nursing, and specialty care, we put our heads together and we came up with this. And this is really some case scenarios really around which we can share perspectives and trying to center this really around the veteran. We are going to present 4 clinical scenarios that I think will represent different aspects of care delivery and hopefully elicit from our panelists, and then have some time after a few minutes after each of the cases to have some robust discussion around aspects that we and key characteristics that we would perhaps want to see in a future state. We'll be sharing both current and future state thoughts. So I'd like to start by introducing the panel. We have Adrian Attizato. He is a veteran, Navy veteran, and also from the Disabled American Veteran Organization. Thank you, and participating with us today. Ms. Mia Powers, who works in our office, the Office of Veterans Access to Care, who has experience of being a scheduler, a scheduling manager, and a scheduling trainer, and has a leadership role in training schedulers across the country. So her input really is, and I'll get to Desiree as well, is in feedback from schedulers around the country and how their experience is, what they experience in our system. Dr. Leonie Hayworth, who did mention that she is a clinical lead in telehealth. She is also a primary care physician at the San Diego VA Medical Center and very well experienced in virtual care delivery. Ms. Desiree Hill, who resides in Southern California and who has been a number of the same roles, right, Desiree? A clinic profile manager, leading other schedulers in our system out on the West Coast, and has experience interacting with the community of schedulers, clinic practice managers as well, and clinic profile managers. And Dr. Cliff Smith, who I work with pretty regularly as well, who is not in our office, but is in a leadership role in the Office of Mental Health Operations, thinking about access and mental health nationally for several years now. He is also still a practicing psychologist in Iron Mountain, Michigan. And I have Dr. Lisa Arfons, who is from the Cleveland VA, working with our office, helping us to think about specialty care efforts and initiatives and access in those arenas as a medical oncologist. So thank you, Lisa, for being here as well. And Dr. David O, who is a practicing pulmonologist at the Puget Sound, Seattle VA, who also is a health services research investigator, and we've worked thinking about that collaboration in care delivery and its evaluation and research over the last, I think, 6 or 7 years now. And Dr. Chris Saslow, who is a nurse exec in the Biloxi VA Medical Center, but who right now is in the acting deputy position to Dr. Boyd, who is the Assistant Deputy Undersecretary for Health for Clinical Operations. So I want to thank all of our panelists who, the coordination aspect, speaking of coordination in some previous sessions, was challenging, but we're going to see how this plays out. So hopefully we'll have some fun with this. I think the next slide, here's the objectives that we were asked to address within these clinical vignettes. And we hope that we can engage and answer these. We'll check in at the end of the session. And as you can see up here on the slide, consideration for through the vignettes of scheduling across a geographically diverse population with varying capabilities and access to technology. So we talked a bit about that this morning. How can we engage with technology to help us provide care across many networks and across the country? using technologies such as online scheduling, mobile apps we heard about, text messaging to enhance some of the user experience, and I think this aligns nicely with some of the no-show work that we heard about in the last session. And then as we look at the populations that with special interests, how can we really ensure, and we touched on that, I think with, there was a question when Dr. Clancy was here about complex patients and then patients with, that may need blind rehab and how we organize that care effectively. And then really, we did also this morning touch on the care in the community and how some of that is coordinated. So I'm thinking that some of the words coordination and the use of technology to help us systematize how we do our work are really of critical importance. And without further ado, other than this triangle slide, which helps us really focus our North Star, as Dr. Lieberman says, which is the experience of the veteran. We're going to highlight that into all of our clinical vignettes. Next slide, please. And we're going to turn it over to Adrian to share, back one slide, please. Adrian to share some overarching comments, and then he will share some comments within the context of each clinical vignette.